today's health, we have Lori Had from Mind Your Body joining us to talk about all things posture and how it can affect how we feel. So let's talk a little bit about the proper way we should sit and stand.
Well, and I'm just thinking everybody at their breakfast table, they'll sit really tall. Mainly a supported skeletal system. And we were just talking about the stomach. It's sort of hanging, so in the thoracic, yeah.
Slowly inching our way back
right.
up.
So if the stomach, if you're slumping, it can't work, and then it affects the liver. So more the organs, and it just feels better. So a couple things we can just do is with the shoulders, just take them up and down. We can do just shoulder shrugs. That feels good. And then just rolling them back. Yeah, and then different occupations affect posture. So one I'm thinking of is dental hygienists. They really are over, or a dentist as well. So they're hurting, and so they're trying to pull their chin level, open their ribs, kind of like an accordion if you think how much this goes. So you don't want to arch either. That's not very effective either. So we can stand and do the same thing, and you can think of your spine nice and tall. And you have gorgeous posture, so
I work on
wonderful. I know, and it feels better. So if you're slumping like this, it's hard to breathe. And think about a coat when it gets cold too. Everybody's got their scarf on, so they're saying that weather really affects our posture too. So that would be one thing. So I'll do one quick exercise, is just clasp the hands behind, and then we're just going to press down through the shoulder blades this way. So you're opening the pecs, traps go down, and all that good stuff. And that's what I was doing. And you can do it on a chair sitting, either way. So
I know, I was telling you that sometimes you see people who are hunched over and you just want to roll their shoulders back.
Exactly.
So how does posture affect also the way we're going to look? Maybe not today, but definitely in the future.
Yeah. Well, the one thing, they make clothes to hang evenly. So the hemlines don't hang on dresses, shirts don't look good, the wrinkles go. So everything is geared to somebody with a really nice set of, the shoulders are square, they're level, chin's very level, like I said. So the posture is for breathing. You can't breathe when you're all, especially laying in a too soft a bed if you're watching TV or something like that. If you can sit up tall when you're eating, digestion goes much better, so as far as posture. So it really affects, there's just so many, especially your organs. So kind of the research I was doing.
And like you mentioned about the dental hygienist, it's not properly, but you can't really control that. In certain jobs, you have to hunch over or things like that. So do you think the best way to prevent or to help your posture is to do some of these exercises you just showed us?
Exactly. And we have a lot of the dental hygienists with yoga laying over bolsters so they can do the opposition of what they've done all day. Also, if you're hovered over a computer, by the end of the day, you want to do something opposite, open it up. Bike riding. Biking's very, hunched over, truly, so you need to oppose that. Swimmers sometimes get a little bit over use of shoulders, so they also need to go both directions too. So
perfect. Well, thank you so much
for
coming in. Everyone, make sure you pay attention to your posture today. Sit up a little taller, maybe.